High blood pressure is often described as the silent killer, not because it suddenly attacks, but because it quietly reshapes your body over years while you continue living your normal life, believing everything is under control. And I want you to pause for a moment and ask yourself something honestly, not emotionally but realistically. When was the last time you checked your blood pressure properly and consistently, not just once at a clinic or casually at home, but over time? Because many people live with the assumption that if they feel normal, their blood pressure must be normal, and medically that belief is one of the most dangerous misconceptions you can have. Since blood pressure damage does not begin with pain, it begins with subtle internal changes that most people dismiss, normalize, or explain away, and by the time obvious symptoms appear, damage is often already advanced and difficult to reverse. Which is why, as you listen to this explanation, I want you to quietly count how many of these signs feel familiar to you or to someone close to you. Because awareness is not meant to create fear, it is meant to create action before irreversible harm occurs, and the first silent sign that high blood pressure may already be damaging your body is persistent fatigue or low energy that does not improve with rest. Something people often blame on aging, stress, work pressure, or poor sleep. Even though chronically elevated blood pressure reduces efficient blood flow to muscles and vital organs, depriving tissues of oxygen and nutrients while forcing the heart to pump harder against resistance, creating a constant state of strain where even simple activities feel exhausting, and tiredness slowly becomes accepted as a normal part of life. And if this description feels familiar, ask yourself whether your energy declines suddenly or gradually, because slow, gradual change is exactly how blood pressure damage hides in plain sight. And closely linked to this fatigue is the second silent sign, which involves subtle changes in concentration, memory, or mental clarity, such as brain fog, forgetfulness, slower thinking, difficulty focusing, or feeling mentally less sharp than you once were, symptoms many people attribute to burnout, stress, or aging. Yet medically, high blood pressure damages the tiny blood vessels that supply the brain, reducing consistent oxygen delivery and causing microvascular injury over time, which not only affects daily thinking and decision-making but significantly increases the long-term risk of stroke and vascular dementia. And this is often the stage where people later say they wish they had paid attention earlier, because the brain does not send loud warning signals before serious damage develops. And the third silent sign involves changes related to kidney function that people rarely associate with blood pressure, such as waking up more frequently at night to urinate, noticing foamy urine, or experiencing subtle swelling in the hands, feet, ankles, or around the eyes. And this happens because the kidneys are extremely sensitive to pressure changes, and sustained high blood pressure damages the delicate filtering units called glomeruli long before standard laboratory tests clearly diagnose kidney disease, meaning these early changes are quiet warning signals that something deeper is happening internally. And many patients later admit they never connected these signs to blood pressure until significant kidney damage had already occurred. And the fourth silent sign appears in vision, where gradual changes such as blurring, difficulty adjusting to light, brief dimming episodes, or reduced visual clarity are often blamed on screen use or aging. Even though high blood pressure slowly damages the delicate blood vessels of the retina in a condition known as hypertensive retinopathy, and unlike eye strain, this damage develops painlessly and accumulates over time, increasing the risk of permanent vision loss if blood pressure remains uncontrolled. And the fifth silent sign involves persistent headaches, pressure sensations, or neck tightness, especially in the morning, that do not respond well to usual remedies. And while not all headaches are caused by high blood pressure, chronic vascular strain increases pressure inside blood vessels and surrounding tissues, leading many people to rely on painkillers that temporarily mask symptoms while the underlying cause continues unchecked. And this habit of treating discomfort rather than addressing root causes is one of the reasons hypertension remains so dangerous despite being so common. And here is a critical truth that needs to be clearly understood. You do not need to experience all of these signs to be at risk. Even one of them combined with elevated blood pressure readings is enough to justify attention, because blood pressure damage is cumulative. meaning the longer it stays uncontrolled, the more harm it causes silently, which explains why people who felt mostly fine still experience sudden heart attacks or strokes without warning. And another widespread myth is believing that blood pressure only matters when numbers are extremely high, when in reality research shows that even mildly elevated blood pressure sustained over time significantly increases cardiovascular risk, especially for individuals with diabetes, obesity, smoking habits, chronic stress, poor sleep, or a family history of hypertension. And if you are wondering why high blood pressure is so difficult to feel, it is because blood vessels lack pain receptors that alert you when pressure is damaging them. So the body often remains silent until organs begin to fail, which is why regular monitoring is far more effective than waiting for symptoms. And what actually helps prevent this silent damage is not extreme diets, fear-based restrictions, or short-term fixes, but consistent, medically supported habits such as monitoring blood pressure properly over time, reducing excessive salt intake, managing stress levels, staying physically active through regular walking or moderate exercise, maintaining a healthy body weight, prioritizing sleep because poor sleep increases stress hormones that raise blood pressure, and taking prescribed medications consistently when recommended, because blood pressure medications are designed to protect organs rather than simply improve numbers, and stopping or adjusting them without medical guidance allows silent damage to return. And it is important to understand that controlling blood pressure is not about achieving perfection but about maintaining consistency, because small improvements applied daily protect the heart, brain, kidneys, and eyes far more effectively than drastic changes followed briefly. And as you reach this point in the explanation, I want you to pause and reflect honestly. How many of these signs felt uncomfortably familiar? 1, 2, or more? Because if even one resonated, that awareness is not something to ignore but something to act on. And if you have a question about blood pressure that you have been quietly wondering about or unsure how to ask, write it in the comments, not for diagnosis but for understanding, because chances are many others are silently thinking the same thing. And if you want calm, evidence-based explanations without fear or confusion, subscribe to Medical Truths with Dr. Nimra and share this video with someone you care about. Because high blood pressure rarely announces itself, but the damage it causes can quietly change lives when ignored.